Have you been feeling unusually tired lately, even after a good night's sleep? Maybe you're always thirsty or hungry, even right after eating a full meal. These symptoms might seem normal, but they could be a sign of something more serious: prediabetes. Prediabetes affects millions of people without them even realizing it, as the symptoms are often silent or mistaken for something else. The positive news is that prediabetes can be reversed with lifestyle changes. Today, I'll share 14 early signs of prediabetes that could indicate higher than normal blood sugar levels. Stick around until the end, as I'll also provide useful tips to prevent diabetes altogether. Let's get started. 1. Frequent urination. One of the most common and often overlooked signs of prediabetes is frequent urination. This symptom occurs when the body cannot effectively use insulin to transport glucose from the blood into the cells. As a result, glucose builds up in the bloodstream, causing the kidneys to filter more glucose than usual. Since the kidneys can only handle a certain amount of glucose, the excess is excreted through urine. This process leads to a condition called osmotic diuresis, where more water is pulled into the urine, causing a person to urinate more frequently. If you notice that you're waking up multiple times at night to use the bathroom or urinating more than usual during the day, it might be worth getting your blood sugar levels checked. 2. Constant thirst and dry mouth. Alongside frequent urination, constant thirst is another sign of prediabetes. When you urinate more frequently, your body loses more water, leading to dehydration. The body reacts by making you feel thirsty. Even if you've been drinking plenty of fluids, you might also experience dry mouth, which occurs due to reduced saliva production caused by dehydration. The sensation of dry mouth can be uncomfortable, often making it hard to speak clearly or even eat certain foods. If drinking water doesn't seem to quench your thirst, consider consulting a healthcare professional. 3. Unusual hunger and increased appetite. Do you often feel hungry shortly after eating? This is a common symptom of prediabetes, where the body's cells struggle to use glucose for energy due to insulin resistance. When the cells don't receive the energy they need, the body sends signals of hunger to try to compensate. This can lead to overeating, which unfortunately only raises blood sugar levels further. The constant feeling of hunger can also be linked to hormonal imbalances, specifically related to hormones like leptin and ghrelin, which control appetite. If you find yourself constantly reaching for snacks, it's a sign that your body's energy balance may be off. Slow healing of wounds, cuts, or sores is another potential sign of prediabetes. Elevated blood sugar levels can damage small blood vessels, reducing blood flow to the affected areas. This lack of proper blood circulation means that less oxygen and fewer nutrients reach the wound, slowing down the natural healing process. The body's immune system may also be compromised, making it less effective at fighting infections that could develop in the wound. If you notice that even minor cuts or bruises take longer to heal, it's a red flag for potential blood sugar issues. Feeling tired all the time, despite getting enough rest, is a major indicator of insulin resistance. Because the cells are not able to use glucose properly, energy production in the body decreases. Additionally, insulin resistance can affect cortisol and other stress-related hormones, contributing to feelings of fatigue. People with prediabetes may also suffer from poor sleep quality, including sleep apnea, which further reduces energy levels. Chronic inflammation, commonly present in pre-diabetic individuals, can also play a role in persistent tiredness. Have you ever experienced blurry vision that comes and goes? This can happen when high blood sugar levels cause the lens of the eye to swell, changing its shape and making it difficult to focus. Temporary fluctuations in vision can occur as blood sugar levels rise and fall. In severe cases, long-term high blood sugar can lead to fluid buildup in the retina, a condition known as diabetic macular edema. Pre-diabetic individuals are also at higher risk for developing cataracts and glaucoma, so regular eye exams are essential if you have any vision changes. Frequent infections, especially in the gums and skin, can be a sign of prediabetes. The immune system becomes less effective in people with prediabetes, making infections more frequent. Gum infections, skin infections, and even yeast infections can occur more often. Elevated glucose levels in the blood and saliva create a breeding ground for bacteria, increasing the risk of gum disease. Similarly, glucose in the urine can lead to urinary tract infections or UTIs. If you're dealing with frequent infections that take longer than usual to heal, This could be a sign that your body's immune response is weakened. Tingling or numbness in hands and feet is another symptom to watch for. The nervous system is sensitive to high blood sugar levels, particularly in the extremities like hands and feet. This can cause tingling, numbness, or a burning sensation in these areas, a condition known as peripheral neuropathy. Nerve damage caused by high glucose levels can become permanent if blood sugar isn't managed. If you experience this symptom, it's a strong indicator that blood sugar levels may be affecting nerve health. Have you noticed that it's becoming harder to focus or remember things? Prediabetes can lead to fluctuations in blood sugar that affect mental clarity. When glucose levels are too high or too low, the brain may not receive the steady supply of energy it needs, causing cognitive issues like brain fog. Additionally, stress hormones can become imbalanced, making it harder to think clearly and retain information. Poor concentration can impact daily productivity and overall quality of life, so it's important to address this issue. Unexplained weight loss. Unexpected weight loss without any changes in diet or exercise routine can be, well, alarming. In prediabetes, the body may start breaking down fat and muscle tissue for energy since glucose isn't being used effectively. This can lead to sudden weight loss even when eating regularly. Additionally, the body loses water weight due to frequent urination. Rapid or unexplained weight changes should always prompt a medical evaluation. Erectile dysfunction. Men with prediabetes might notice difficulties in achieving or maintaining an erection. This is due to poor blood flow and potential nerve damage caused by high blood sugar. Hormonal changes such as decreased testosterone levels can further contribute to erectile dysfunction. If these issues persist, it's advisable to seek medical guidance to evaluate potential causes, including blood sugar levels. Mood swings and irritability. Mood swings can be a surprising symptom of prediabetes. The body's inability to regulate glucose efficiently can lead to fluctuating energy levels, which impacts mood stability. Hormones like serotonin and dopamine, which regulate mood, can be affected by inconsistent glucose levels, resulting in irritability or anxiety. Poor sleep, a common issue among those with prediabetes, can also contribute to these mood changes. Dry, itchy skin. Dry skin can be caused by dehydration and poor circulation, both of which are common in prediabetes. The lack of proper hydration to the skin leads to dryness and itching. Nerve damage can also interfere with the function of sweat glands, reducing the skin's natural moisture. If you're experiencing persistent dryness and itching, especially without clear reasons, it may be linked to blood sugar levels. Abdominal fat gain and insulin resistance. Excess fat around the abdomen is one of the most visible signs of insulin resistance. High levels of insulin in the blood promote fat storage, particularly in the abdominal area. Chronic inflammation, a result of insulin resistance, can also contribute to belly fat. A sedentary lifestyle and a diet high in refined carbohydrates further exacerbate this issue. If you've noticed any of these signs, it's time to make changes. Here are some effective ways to prevent diabetes. Healthy eating. Focus on a balanced diet rich in vegetables, whole grains, lean proteins, and low glycemic fruits. Reduce refined carbs and sugary foods. Consulting a nutritionist can help create a meal plan that suits your preferences and nutritional needs. Regular exercise. Aim for at least 150 minutes of moderate activity weekly, such as walking, swimming, or cycling. Strength training can also improve insulin sensitivity. Manage stress, practice meditation, yoga, or other relaxation techniques to keep stress in check. Sleep well. Aim for 7 to 8 hours of quality sleep. Avoid screen time and heavy meals before bed. Stay hydrated. Drink plenty of water throughout the day to prevent dehydration. Quit smoking and limit alcohol. Both habits can worsen insulin resistance. Regular checkups, monitor blood sugar levels, and get routine health checks. By following these tips, you can reduce your risk of developing diabetes. Let me know in the comments if you've experienced any of these signs. Don't forget to like, share, and subscribe for more health tips.